You've exercised, dieted, and you've tried just about everything, but you can't seem to get rid of those darn trouble spots. Is liposuction the answer for you? Joining us to explain is Dr. Robert Heck from Columbus Aesthetic and Plastic Surgery. Thank you for joining me, Dr. Heck.
Thanks, Gail. Thanks for having me.
I did not know there were different types of liposuction, so let's start by explaining what some of those types are.
Okay. Well, liposuction is one of our most popular procedures. We probably do 3 to 5 procedures a week. The basic principles of liposuction are the same. You're basically removing unwanted fat cells from trouble spots in your body through tiny incisions. The great thing is there are new technologies that allow you to do that with lasers or ultrasound that allow you to be more precise and get better results.
Is it as good as it is if you would do the regular surgical procedure?
You know, it depends. It's patient dependent, but a lot of times it's better. We offer all types of liposuction at Columbus Aesthetic and Plastic Surgery, and each patient is different. There are some patients that power-assisted liposuction is better. There are some patients that smart lipo is better.
So you can look at the patient, though, and look at their body type and what they want and suggest what you think is going to work for them?
Absolutely. Absolutely. There are some patients who are athletic in build and nature and have just very tiny spots, and those patients, smart lipo or Vaser may be a better choice for them because you can actually heat the fat and heat the skin and melt the fat before you remove it.
So you really can melt fat away.
Absolutely.
But will it come back? I mean, after you go through this process, will it go back to those trouble spots?
You know, it's kind of a myth. There's a big myth that once you remove that fat will come back in other places, and it's not exactly true. If you have liposuction and you go out and gain a bunch of weight, you can put fat on in other spots, but once those fat cells are removed, they're gone forever. They're not going to come back.
Well, do tell folks, all right, I'm going to help you, but first you have to do this, you have to lose some weight, you have to diet. I mean, are there folks that you say, this isn't going to help if you don't change your lifestyle?
We do. You know, a lot of people think that liposuction is just for overweight people, and it's actually just the contrary. When we see overweight people, we do try to put them on a diet program first, but really there's no easier way to lose that fat than liposuction, and that's what we do.
And those trouble spots, really, as you said, a lot of these folks aren't overweight, but there are some spots, the hips or whatever, the stomach area, that just seem, especially as we age, that everything collects right there.
You know, the biggest majority of our patients are patients who are at their goal weight. They just have a little problem area on their hip. They just don't like the way their love handles look. And that's really what liposuction is for. And there are procedures called micro liposuction or liposculpting where we take those areas and we just fine-tune them and make you look better in clothes or naked, whichever you prefer.
Well, thank you for that.
Sure.
What's the cost of this? And I know every procedure is going to be different.
Liposuction ranges anywhere from $1,500 to $6,000. Depending on how many areas you want, how large those areas are, things like that.
Is it major surgery if you do the surgical part?
You know, it is. You know, these new technologies have made our job easier, but the bottom line is your results depend on the skill of your surgeon. And it is something to be taken seriously.
Yeah, it is. Even though it's an elective surgery, there's still going to be some downtime, right, and some recovery from this.
Recovery time is about a day or two. Before you're doing normal daily activities. It's probably about a week or two before you're back at the gym.
Well, that's not bad.
It's not bad.
And so we really have made a lot of advances when it comes to this sort of surgery, this type of technology.
Like I said, I think the basic principles have been there for a long time, but the technologies now are great.
So people will just come to you and ask for to sit down, have a consultation, and you can talk them through as what is best for them.
Absolutely, and it's different for everybody.
All the more important to come see you first.
Right.
Thank you, Dr. Heck. Very interesting.
Sure.
Happy holidays to you.
Thanks. You too. Appreciate it.